Service of South Florida PBS was created for you to provide the highest quality health and wellness for our community. Everywhere you go, we're here 24/7. Watch us live and get your health questions answered.
Thank you for calling into the Health Channel.
Or find topics that interest you from our comprehensive online video library. Find us on Comcast and Hotwire Cable, download our mobile app, or visit us at allhealthtv.com. The Health Channel. All health, all the time, everywhere you go.
Next time on Jazz.
What a mess we are.
He's a fine actor.
Partnership of God.
Elizabeth I.
Midsummer Murders.
Charlize Theron and Frances McDormand. It's exactly the same.
He wants us to find
the best programs this February are on South Florida PBS, shining the light on science.
We're facing a man-made disaster on a global scale.
It's happening in your world, it's happening in my world.
And nature.
Go beneath the surface and meet Africa's river giants.
Examining history.
Elizabeth I was proud of her power.
Who knows where fact and fibs may take us next?
Your beacon of light and your most trusted source. South Florida PBS.
The Biden administration recently reopened the Affordable Care Act marketplace, far ahead of the usual November timeframe, so more people who may have been affected by the COVID-19 pandemic could sign up for health insurance. But who qualifies for the special enrollment period and who benefits most? Coming up, we'll speak to a panel of experts and ask them your questions. We'll get real answers to help you and your family find the help and the health insurance protection you need. It's straight ahead on this Smart Life Special.
Welcome to ACA, what you need to know, a Smart Life Special virtual town hall, and we welcome you. We're here to help you better understand how you can qualify for low cost, or in some cases, even no cost health insurance for you and your entire family. We have a fabulous panel of experts with us this evening, and I'd like to start with Penny Schaefer, Market President for Florida Blue South Florida, followed by Dr. Raul Daza, Medical Director of the Sanitas Medical Centers, and finally Islara Soto, Director of the ACA Navigation Program for Epilepsy Florida. Thank you all for joining us tonight.
Thank you for having us.
Now, before we get started, I just want to let our viewers know that this virtual town hall is coming to you live. So if you have any questions for our experts, please reach out. You can send your questions to questions@allhealthtv.com, or you could put it in the comments section on Facebook or YouTube. So Penny, I want to start with you, if that's okay. The new administration, which we just heard a few seconds ago in our open, recently reopened the ACA marketplace to all people to allow people to enroll in health insurance plans. So tell us what this means and how different is this year?
Sure, of course. Well, the typical open enrollment period has been in the fall. Most recently, it's been sort of November the 1st to December 15th. So trying to get things done in about 6 weeks period of time. As we know, though, the impact of COVID, and particularly with individuals who have seen job loss or reduction in hours or move to part-time and other things, may be no longer eligible for their employer-based insurance and may not have been fully educated or aware of that open enrollment period and may have missed out on the opportunity to sign up. So this represents an opportunity for anybody who is not covered under employer-based insurance to access and really from February 15th to May 15th, examine their alternatives for actually gaining coverage.
And we were talking about, Penny, before we started our town hall, how important it was to create this awareness because so many people are unaware and the opportunity is there.
Yeah, there are some scary statistics in a way. I mean, the good news is South Florida has the largest enrollment of any place in the country, but we also have the largest number of people who are still uninsured but eligible for assistance, who are still sitting out. And we think that there's an option for so many people, and they are just not fully aware of the options that are available. So a venue like this, a forum like this, is very important for our community.
Absolutely. Dr. Daza, let me bring you in. You're the medical director of several regional medical clinics. How do you think this special enrollment period will affect the Sanitas centers?
Well, Olga, we have 35 medical centers across Florida, and we focus mostly in the ACA population, the ACA market. We know that this is a great opportunity for more members to enroll, for more patients to be seen. We are ready to see this increase in patient population. We have doctors and nurse practitioners ready to take care of them and all their primary care needs.
Thank you, Doctor. And our next question has to do with who qualifies for this special enrollment. And I'm going to cover that. But before we do, I want to quickly play a testimonial from a local business owner named Luli. Let's take a look at this.
My name is Luli, and in 2018, I found myself divorced and a single mom of 2 teenage sons. I'm so grateful that a chance meeting at a local insurance office gave me the guidance that I needed to learn about my qualifications for the Affordable Care Act. You see, I hadn't even considered it because I didn't think I would qualify. With the current extensions of deadlines now in place, I encourage you to do the same. Get more information about how you and your family can benefit from the current extensions and this incredible act now in place.
Great information there. Islada, you're the director of the ACA navigation program at Epilepsy, Florida. Can you explain who is eligible to enroll in the ACA?
Absolutely. So to be eligible to enroll in an ACA marketplace plan and receive financial assistance, you must be a U.S. citizen or national or lawfully present and living in the United States. This includes those with resident cards, work permits, asylees, refugees, and several other types of qualified non-citizens. And additionally, you cannot be currently incarcerated. So that is something you cannot be. But I do want to mention that signing up for an ACA plan and receiving financial assistance will not jeopardize your path to citizenship or your resident status.
And that's important to note. Can you also discuss immigration status rules and what that means for eligibility as well? A lot of people out there.
Immigration status, well, legally present. So you will have to prove your residence. You have to provide your green card number, I-94. You do have to provide documentation to the marketplace that so they can verify your status in the United States. There are some different categories, asylee, refugee, where you don't have to necessarily provide documentation, but we can help sort through all that.
Fantastic. Penny, I want to talk about just the fact that health insurance sometimes is often considered out of reach for those who can't get it through their employer, through their jobs. It's much more expensive when you're on your own. That I've learned by being a freelancer in my life, and I can see how much more one has to pay when it's coming out of your pocket as opposed to being under an umbrella, shall we say.
Sure.
People feel that it's sometimes unobtainable. You just can't reach it. Can you talk about the affordable options, including some low-cost and even no-cost plans? And I want to repeat that for our viewers to hear this. Low-cost and even no-cost plans. They do exist. Penny?
So let's remember that the ACA, or Affordable Care Act, starts with the word affordable. And the notion was to try to create pathways to make it more affordable. We'll all agree that there are more things that we can be doing, and current administration is certainly looking at options. But right now, even as we speak. The most important thing for somebody to understand is that there is assistance. It's on a sliding scale. So don't disqualify yourself. Seek advice from a licensed agent or professional to really understand what your options are. But if you think about it, if you are eligible for one of the subsidies, it not only will help you with the monthly premium, which is something that a lot of people worry about, but it also can help you with some of the member cost shares. Think about things like co-pays and those kinds of things. And so many of the services that are included in insurance products are absolutely free. So you think about your prevention visits, you think about some of your preventive testing, so your annual mammogram and some other tests that are all free as well, that are included as soon as you have coverage. And so whether you've looked at a high deductible plan and said, gosh, could I afford that? Understanding what is covered from the minute you've got insurance that is actually prevention is pretty important. If you look at the majority of people that have an affordable care product, 9 out of 10 will receive some level of subsidy. 3 out of 4 actually pay $50 or less for that coverage.
$50 or less.
3 out of 4. So don't disqualify yourself. Go through the eligibility checking.
And in turn, receiving things like a mammogram, which is so important to do, things like a colonoscopy, things that really are important for our health.
Absolutely. Isleta, I know you've seen a lot of people come through your doors who were amazed to find out that it was practically free.
Absolutely. I have people coming in with the worst expectations, and then they're just blown away about what they can get and so grateful. You never know. It's on a case-by-case basis because it is a sliding scale for the financial assistance, and every family and every individual is different. So just you need to be aware of what's available to you.
Can you share some of those experiences, Isleta? I know you're not going to mention names, obviously, but when someone comes in and they say, you know, Isleta, I can't afford this deductible. What is the point of getting this plan? It's not going to help me. How do you embrace that conversation and help them see, no, you need to listen and let me show you why?
Well, I'm going to mention some of the things that Penny just mentioned as well. But in short, enrolling in an ACA plan will provide you with free preventive care, protection against astronomical medical costs, and peace of mind that you're covered should anything happen. And that is because, as Penny mentioned, we have the preventive health benefits. All ACA plans come with well visits covered at $0, vaccinations. There's different categories and different benefits and wellness checks that apply towards women, men, and children. So all of those are free at no cost. And then there's also what I like to share with someone who is very hesitant to even enroll in a bronze plan with a high deductible is that there's what's called out-of-pocket max. Now, to keep it simple, an out-of-pocket max basically puts a cap on the amount of money you're going to spend out of your pocket in a calendar year for in-network and covered services. So even though you may see a high deductible that's really scary, you have that peace of mind that should anything major happen, you will have that out-of-pocket max capping the amount of money that you are going to spend in that calendar year. So it can maybe, go from a bill in the hundreds of thousands of dollars to if you have an out-of-pocket max of, let's say, $8,000, which could be the same as your deductible. It sounds a lot when you're talking about deductibles, but it's a whole lot less than $100,000 for an emergency service. I also want to mention.
Go ahead.
I'm sorry. There are bronze plans available for $0 a month that actually do have $0 deductibles and co-pays for specific services such as primary care physicians, specialists, and medication. So you can actually find a bronze plan that will allow you to get more than just the preventive health benefits and the wellness benefits at no cost to you. You can go see a primary care when you're sick. You can go see a specialist and get your medications without having to meet that deductible. So there are options.
And are people
And you
pleasantly
really,
surprised when
if I can chime
explain
in.
all of
Oh,
this?
sorry.
It's okay.
They are really amazed. I mean, like I mentioned, I've seen a whole range of people that are just, very hesitant about enrolling, the misinformation and the lack of information about what's out there, what is available to them. It's really more damaging than anything. And when we bring them in and we educate them and we give them a projection, we show them the plans that they have and, the benefits that they can get by getting their annual checkups and their preventive care, and they can finally fill their prescriptions and they don't have to order them from a pharmacy online. It's really amazing to see that difference in people.
Absolutely. Penny?
Just a couple of things. One is, to illustrate that point, a recent poll showed that 60% of people in the United States who were going uninsured were completely unaware that they may be eligible for some level of assistance, which tells us that the education process has to continue, has to go on. So again, forums like tonight are very, very powerful, and we thank you for that. The other thing I was going to mention is, as individuals are shopping for their plans, one of the things to look for is any relationship that the insurance carrier has with particular medical teams. They're typically, known as strategic providers or value-based providers. You can actually see even less expenses. So as an example, our plans with Sanitas are $0 physician visits and 2 urgent care visits a year at $0. So you really do have to kind of delve in and shop a little bit, because there is more value to be had even above and beyond the subsidies or the premium assistance.
Dr. Daza, I want to bring you in because I think it's really imperative to talk about the benefits of these screenings that unfortunately some people don't realize they can get, and they go years without. It's just so important from a health perspective, isn't it? We're talking mammograms, colonoscopies. I'm not sure what the list is in terms of wellness. Maybe you can share.
Yeah, absolutely, Olga. Like Penny and Islara mentioned, that's preventive medicine, right? And that's what we focus on, prevention of disease. A lot of people, when they think of insurance, they're thinking of, I'm covered for a disaster, for a catastrophe, for something bad happening, but they're not thinking of preventive medicine. What we need to focus is on that. How to prevent that catastrophe from happening, how to prevent that cancer from developing, how to detect it earlier. That's what preventive medicine is. And like Penny and Islata were mentioning, all of those services are at zero cost in the Affordable Care Act. And what we've seen is a lot of people that have come in without insurance in the past, that because they were delaying care, not visiting the doctors, we sometimes catch them, later on, and it's much more costly, not only for the patient, but the burden on the family and everything else, going through surgery and things that we can prevent early and detect earlier. We have seen now that people are getting more aware that they have these benefits, that they don't have to pay for those. For example, colonoscopies for early detection of colorectal cancer, mammograms for early detection of breast cancer, pap smears, cervical cancer screening for cervical cancer, which starts much earlier in life. And screening, it means that it's detecting something or looking for something before symptoms happen. So people feel many times that they don't have to visit a doctor because I'm feeling fine, I'm not sick, but that's precisely the value of having those annual wellness exams and those screenings performed. It's preventing disease.
And preventing it before it's too late. And I actually have a personal story, but before we get to that, I want to get to this question from Carolina. And this is something, Penny, Islata, and Dr. Daza, that we've been already talking about in the last 20 minutes or so of our town hall. She's from Dade County, and she writes, I haven't had health insurance for many years, but this year with COVID, I'm very scared. Penny, one can understand.
Absolutely. And what I want to do is reassure you that the world is open to you right now. You have these next couple of months to actually go and revisit your situation. I heartily recommend that you talk to a professional, talk to somebody on Islara's team or one of the licensed agents out there, because I don't know what your employment status is or what your income status is, but I'm going to guess that if you've gone without insurance for the last few years, you probably are in a category that would allow you to get some premium assistance from the government and make this affordable. And let's get you back on the right track to good preventive health.
And get those wellness benefits that one can get for $0. And I don't even mind sharing that Penny helped me. I want to say it was about a year and a half ago, Penny, or so. And I was shopping around for insurance as well. The cost astronomical. Don't have an employer to help back me up in that sense. And I worked with Penny on it. And because of that, I got a colonoscopy, which I had put off, not only because of insurance, but even because of COVID. And they discovered I had a polyp. So lo and behold, we caught it in time, thank goodness. And it's my message to others out there to say, you know, you can get these benefits, you can get these wellness services. Absolutely. And Islara, it can happen to me, it can happen to you, it can happen to anyone where you get it and sometimes too late. And we don't want that to happen, especially when there's something out there that can help.
Preventive, not reactive care.
Oh, and Olga, just like you mentioned, there's so many stories that we see every day with colonoscopies, with mammograms, young women who, you know, have postponed a pap smear, just a gynecological visit for so many years, where we detect something early and we can save a person's life. I have, you know, families calling me saying, "Thank God for the work that you guys are doing and checking," you know. Because a lot of people think it's just about doing check boxes. I did a mammogram, I did this, but it's we're talking about patients' health, right? And we're in the business of promoting health, not preventing. You know, preventing sickness, promoting health, not treating sickness, which I think is, you know, the change that we have to have in healthcare.
If I can chime in as well, one of the things you want to make sure, you know, I run into people on the street in the meetings and things like that who say, "You'll be proud of me. I never take my insurance card out of my wallet." And I'm like, well, I'd actually like you to do it at least once a year because I want you to get those preventive screenings. I want you to get those labs every year because they form the baseline. And then we actually are in a position to watch the numbers, you know, obviously clinical professionals, not me, but you can watch those numbers. And many times before you ever get into a danger range, you can see something that's starting to escalate and really get ahead of it. And so without that baseline, you don't have the ability to do that. And so strongly encourage, you know, don't keep it in your pocket all year long. At least use it once a year to get that annual physical and get those labs and baselines.
Indeed. By the way, I just want to remind our viewers that if you have a question for our fabulous panel of experts, we'd love to hear from you. You can send in your question right now. We are live at questions@allhealthtv.com. That's questions@allhealthtv.com, or you could just put them in the comments section below on your Facebook and YouTube as well. Penny, let me ask you this. How can people get help enrolling in a health insurance plan? Because again, it's sometimes very confusing, and find out how much financial aid they may be eligible as well.
Sure. So, you know, we really think that it's important that you talk to an expert on that. And certainly Islara's team is a set of experts that can help people through it, as well as licensed agents or brokers can help with that. We're not passing out telephone numbers tonight, but, you know, we have our Florida Blue centers that while they're not seeing people face-to-face in the office, they are seeing people face-to-face via video chats and other things. But it's important to talk to a professional. You know, we've talked about the fact that this is accessible. I think that, you know, I said, please don't disqualify yourself. If you think about it, a family of 4 with a total income of $100,000 a year still qualifies for assistance. And so if you make less than that, I guarantee you're going to qualify for assistance. And so many people out there listening kind of disqualified themselves from any level of assistance, but it really is 4 times the federal poverty level, again, on a sliding scale. So don't disqualify yourself. Absolutely seek advice of a professional so that you can understand what you truly do qualify for.
And Dr. Daza, at Sanitas, many of your patients are also enrolled in ACA Marketplace. And many of them come to you after really not having insurance for many years. What transformations have you seen from those who, once they get access to healthcare and you see the transformation in their lives?
Yeah, I mean, like I said earlier, there's so many stories, especially in our area in South Florida. We have so many people who are immigrants who spend some time a lot of time without insurance, maybe, and come here with with a dream, with plans in their mind, and all of a sudden they find themselves sick and having nowhere to go. Now with health insurance, they learn a lot about preventive medicine. I'm Hispanic, and many in South Florida are Hispanic, and the culture of preventive medicine is not entirely there. People only go to the doctor when they're sick. So learning about primary care, about seeing the primary care doctor as a quarterback of their care, helping patients navigate the system, which is not easy to navigate, and saying, you know what, this is the doctor that you should be seeing. This is the medication that you should be taking in case of people with chronic conditions where we want to prevent complications. So it's really not only about taking care of them, but also educating them about the system, educating them about what's available for them. Like Penny and Islada were saying, many things are covered at zero cost, and even urgent care visits for some plans. So it's been great to see the transformation in a lot of people, them going back saying, telling their families, look, you can come in and see this group of doctors with this type of plans. And so, there's a lot of stories of very, very, very good ones.
And Penny, I have a question from a viewer. Her name is Jackie. She wants to know how the subsidies work. Can you explain that?
Sure. So the way that the assistance works is, again, it's on a sliding scale. So it's based on your income. The lower your income, the more of the premium assistance or the subsidy are you eligible for. It will cover a portion of the monthly premium, which is the coverage. It will also potentially cover some of the cost shares, like a co-payment or co-insurance. And so that's real assistance that saves you that upfront, those first dollars. One of the things that people can do to become a little more aware of how this works, to understand a little bit better how insurance works and what options are available, is the getcoveredflorida.com. It's a website to help people understand and become a little more educated on what the options are. Again, that's getcoveredflorida.com.
And now that you mentioned that, Penny, I'm going to ask my director to take a full screen, because we actually have some great numbers and websites that maybe someone would like to jot down right now. As Penny just said, Florida Blue, getcoveredflorida.com. Jot that down. Also, the toll-free number, 844-481-3770. Again, that's 844-481-3770. And the information for Epilepsy Florida, epilepsyfl.com. That's epilepsyfl.com. And their toll-free number, 877-553-7453. By the way, we're going to be showing those numbers at the end of this town hall in case you didn't get it right now. So stand by for that. And we promise to reveal those information for you again. Islada, let me ask you this. When someone comes in and people are now looking for health insurance, do they ask you, what do I think about? Price? Do I think about the hospital? Do I think about the doctors, other costs, all of the above? What should be the focus? What do you say?
Well, there are several things. And I would say that definitely what consumers need to be on the lookout for is a plan that has comprehensive health coverage. There are plans out there that do not cover pre-existing conditions. They maybe won't cover maternity. They may exclude you for certain medications that cover your pre-existing conditions, stuff like that. We call those junk plans, and they may look very attractive because they're very inexpensive on a monthly basis, but you have very limited coverage. So that'd be the first thing I always tell people to be aware of when shopping for an insurance plan. And then there's a couple other things in pricing. I'm going to mention some statistics that Penny also shared, that 9 in 10 consumers who enroll in Marketplace coverage were able to find a plan for $50 or less. So you want to make sure that you are looking at monthly pricing and know that there are options out there available, especially with the subsidies. I think what's important as well is staying in network. It will prevent you from spending unnecessarily. You want to make sure that you familiarize yourself with your network. If you have specific hospitals that you prefer, some over others, or a doctor that you've been seeing that you want to continue to see, there are ways you can filter plans in the Marketplace to show you only those plans that the hospitals and the doctors accept. You can always call your doctor and see what ACA plans they take, or if they just simply are not in your network, and you may have to find another doctor. But it's important for you to stay within your network so that you're paying the least amount of money for your services. Going out of network is typically more expensive. So just, be aware of staying in network. Prescription coverage, I think, is another big ticket. You need to make sure you have singled out the prescriptions that you are taking. Again, you can filter the plans in the Marketplace by prescription, so you can see the specific cost of that prescription. You can see if they have mail order, which is a lot less costly. And if you're also taking name brand medications, it's important to make sure that you are looking at those specifics within the plans to make sure that the plan you choose covers that name brand medication, and ahead of time what that cost is to you, and if you need to get any additional paperwork from your doctor to have that medication covered.
Thank you, Islada. I have a question from Panos from Coconut Creek. Great question here, Panos. He wants to know how he can be covered and still keep his doctor. He's worried about that. Penny, I'm going to give that one to you.
Yeah, absolutely. The key there is to make sure that as you shop for the insurance plan, that you are looking for that doctor in the network, because every plan has a slightly different network. And so you want to make sure that doctor, that's one of the criteria you want to use, is to make sure that doctor is in the plan. I just want to do a little shout out, for your viewers who may not have picked up quickly, what is Epilepsy Foundation doing talking about this? But I want to tell you that they have been helping people understand and shop effectively for insurance since this began in 2013 with the very first shopping experience on October 1st of 2013. And they've been doing a tremendous job and staying power. And so my, shout out to Islada and the team. They're going to give you good advice because they've been doing it for a long time. And her advice on making sure that your physician is in the network of the plan you choose is perfect advice.
Thank you, Penny.
Dr. Daza. And thank you, Penny, for that. Dr. Daza, and I know how I feel. I know how my parents feel when it comes to keeping those doctors. I'm sure you hear that all the time from patients at Sanitas.
Yeah, no, absolutely. That's very important. At Sanitas, we have a large network of providers. We are in 35 different medical centers across the state. We work in teams with nurse practitioners and doctors, but it's very important, that you find that doctor that you feel comfortable with. And like Penny said earlier, use your insurance. Go see your doctor, because again, people keep thinking of their insurance as what I need to use if I end up in the hospital or I need major surgery, and you forget that it's going back to how do I prevent ending up in the hospital? How do I prevent major surgery? And that's through your primary care doctor. So it's great that Panos likes his primary care doctor and wants to stick with his primary care doctor. Look for a plan where your doctor is covered. If not, there are many other doctors and alternatives out there, but look for him. Find the doctor and follow the advice of your doctors as well.
And Dr. Daza, is there a few moments you could spend with us and explain how the prescription coverage works?
Sure. I mean, it also varies from insurance panel to insurance panel, and also the program per se might have a different coverage. It's usually by tiers. Usually generic medications are covered. Brand name medications might have different costs out of pocket depending on the medication and the program that the patient is enrolled in. As physicians, what we look for is for prescriptions that are in the panel for the patient. So it will vary from program to program.
All right. And Islada, I wanted you to chime in too on Bano's question about, worried about coverage, ACA, and keeping the doctor. I'm sure you hear that. And what do you tell them?
Here in South Florida, we have an extensive network of providers, and under every plan that's available in our area. And most of the time, the doctor is in an ACA plan. So it is highly possible to find a plan that you can keep your doctor. And as just mentioned, there are other doctors if your doctor is not in network. But I think the fastest thing to do is call your doctor directly and ask them, I'm going to enroll in an ACA marketplace plan. I don't want to switch providers. Can you please tell me what ACA plans you take? And then filter it from then.
Fantastic. Penny, earlier Islada had talked about the bronze plan. I know there is silver, gold, and platinum. Can you walk us through those as well?
Sure, happy to. So think about it almost like you would an Olympic medal. The more precious the medal, the more value you will in the medal. So I don't think that the Olympics has a platinum yet, but it's only a matter of time. So they're all known as the medal plans. And at each medal level, they have to have a comparable amount of coverage. Maybe not exactly the same benefits, but a comparable amount of coverage. So bronze plans can be compared against other bronze plans. Silver plans can be compared against other silver plans, etc. And so the value of the medal will give you a little bit about how much coverage is included. So if you're an individual that generally has very good health and you want to make sure that you're accessing the preventive, you maybe see the doctor once a year like I hope you do to get that physical and such. Maybe you can afford a slightly higher deductible. That may be where you would choose a bronze plan. If you have slightly more needs in the medical area, so you maybe already take a prescription drug on a regular basis, or you have a family history that you want to make sure that you're watching in your own care, the silver plan will cover more, and it's the most popular plan out there. If you know you have medical concerns and you do need maybe multiple prescription drugs, or you're trying to manage or monitor and make sure that you're keeping in control a condition, maybe it's diabetes or others, you may be in a better position with a gold plan where it has more coverage, but you know that you've got more expenses without it. And so it makes it valuable. And then the top is the platinum plan. And that has extensively more coverage, usually a larger network, and is for the individual who really needs the more than just comprehensive coverage, but is a regular user of the health system to manage perhaps chronic illness and other things. So bronze is sort of your entry level up to silver, gold, and platinum.
And once you receive one of those plans and get into one of those plans, can you graduate to another one after a certain amount of time?
Well, the good news is if you're taking care of your health, you could actually maybe move down as opposed to move up. Oh. But you are allowed to revisit your health insurance coverage on an annual basis. That's your open enrollment period. And so if your needs have changed, if things have changed, of course you can graduate up. But under people like Dr. Daza's care, who's going to be very preventive, he's going to get your chronic conditions under control. You're going to need less medications, and maybe he'll move you down to a silver as opposed to up to a gold.
Dr. Daza, I think I'm going to start seeing you as my physician.
That would be great. You're more than welcome. I think it's also important to mention, under any of those plans, those preventive medicine visits are entirely covered, right?
Yes, they
The
are.
screenings are entirely covered. So we go back to the preventive medicine portion of things, right? It doesn't matter which plan you choose. What changes is, your out of pocket that the doctor was a cost, but the basic care is covered in all of those. And also I wanted to say something. Anna's question is, even if you can't keep your doctor, what I do encourage all of our patients is to keep good track of your medical records, because if you can carry your medical records from one doctor to the other, you can hand over that care, and you don't lose the care even if you change insurance plans. So it's important that patients also feel a little bit of ownership of their health and say, okay, this is my medical history, and if I need to change my doctor for whatever reason, things happen in life, I can take that to the next doctor who will continue taking care of me.
That's a great
Good
point.
advice. I'm going to steal that from you.
A lot of us are always looking for what we did, lab, everything, and it's just all not available to us, and it should be right there in front of us in case that should happen, or in case we've had to move to another location. I'd like you all to chime into this question, because I think it's important considering the awareness we're creating. A lot of people just are not aware of this fabulous tool. Penny, I'm going to start with you. What is, I guess, the question you are asked most often about open enrollment?
So most people are confused about the timing and what they need to do during that period of time. So under normal circumstances, that's a 6-week period in the fall. It's November to December 15th. It is the time when you get to revisit your insurance coverage. So who am I seeing? What am I covering? What am I paying for that? Who's in that network? And you get the chance to relook at it every year during that open enrollment period. Right now, the good news is we have a special open enrollment period. So between now, starting February 15th, but from now until May 15th, you get an extra opportunity this year to revisit your coverage. So whether you're uncovered today or need to revisit that coverage, this is a perfect time to do it.
Have you had more interest, Penny, now that there's a special opening?
We are seeing interest. The phones are ringing, the video chats are going on, because frankly, because of COVID, a lot of people did not recognize that they had the option to look at an Affordable Care Act plan. They knew they had gone through hard times. They knew that their employer may have reduced their hours, or, had to put them on part-time, or may have even had to furlough them.
I think we had a small issue with Penny's Wi-Fi, so hopefully she'll come back, and we'll give her a couple seconds to fix that Wi-Fi in her house. Islata, let me ask you the same question I asked Penny as we wait for her to rejoin us. What is the question you get most when it comes to open enrollment?
Well, when it comes to open enrollment, we mostly get, does that affect me? Consumers just are not sure of who is eligible to enroll and who isn't. Does it affect me if I have employer-based coverage? Does it affect me because of my immigration status? And basically, it's open to anyone. It's open to anyone as long as you meet those qualifications, U.S. citizen or national, or you have any, legal status in the United States. If you have employer-based coverage, your open enrollment is probably during a different time in the year. You would want to check with your employer, but it's just the lack of education that's out there, that people are just not aware of when the open enrollment period is. A lot of marketing has been diminished, and so the open enrollment periods are just they're just not out there like they used to be at the beginning of the Affordable Care Act. So people missed the deadlines, and they weren't sure that it pertained to them or not.
Exactly. And we got Penny back. So Penny, if you'd like to finish your thought, welcome to the virtual world.
I was going to say, it wouldn't be Skype, a Zoom, a team, or whatever we're living with right now if we didn't lose somebody at some point. So my apologies to any of you. I think the education is the key point. You know, it is an opportunity to educate people, whether it's in that fall open enrollment period or this special open enrollment period. And anybody who was impacted by COVID and the pandemic, lost hours, was converted to part-time, may have been furloughed. It's a chance to make sure you have comprehensive insurance.
It really is. I actually want to spend a few moments, if you all don't mind, since we're talking a little bit about COVID. And Penny, you and I were talking a few seconds before we started this town hall. And I think it's important for our viewers to also be educated as to what Florida Blue is doing. There are a lot of locations opening up when it comes to getting the vaccine, whether it's Moderna, Pfizer, or the Johnson & Johnson. The more the merrier. I know Florida Blue is helping the community in terms of directing people to those locations. Can you share that with our viewers?
Sure, happy to. So I think what most people are finding is eligibility is an important gate right now. So we are hearing every day of more categories of individuals who are eligible to receive the vaccine. Then the second gate is the inventory. And with new emergency use authorization of new providers, new manufacturers, that increases the inventory. But there is no central place to sign up for your vaccine. And so people are trying to find where to get the vaccine. Do I go to a hospital? Do I go to a pharmacy? Do I go to a FEMA site? Where and how do I sign up? And people are spending a lot of time online, and they're trying to figure out the right eligibility and the right inventory, frankly, for where they can get the vaccine. We recognize that that's a little bit confusing. And so, number one, we want everybody to roll up your sleeves and get the vaccine when you're eligible, and to test or understand your eligibility and where there's inventory. We have a set of community specialists across the state who are there to kind of help guide you. These are trained social workers who have resources at their fingertips to help you figure out in your zip code, in your area, who's providing the vaccines, what's the current eligibility level, and what's the current inventory. It's important.
It's very important. Dr. Daza, I'm going to talk to you about the vaccines too, but I wanted to also ask you that question that I asked Penny and Islada regarding the questions you get. What is the first one that comes to mind that most of your patients ask you regarding open enrollment?
How much am I going to have to pay? Right. That's the most common question. But in reality, I mean, I think Islada and Penny covered it very, very well. People don't know what's out there. They don't know what they're eligible to get. And many times many are waiting for the last minute. That window at the end of the year, like Penny was saying, is very short. Now we have a big window of opportunity here for more people to get enrolled and get educated and find out that they have access to healthcare. So the work that groups like Islada is doing is great to teach the consumers of how they can get affordable coverage.
And speaking of cost, I'm going to piggyback on that and say that there's no cost with the vaccine. It is absolutely free, gratis, cero, zero. And Dr. Daza, I know you have some, I guess, breaking news that Sanitas finally got the vaccine.
Yes, absolutely. We're super excited. We got the vaccine today from the Johnson & Johnson inventory. And we actually have 10 sites enrolled throughout the state. And we got 1,000 vaccines in each one of our sites as the Johnson & Johnson vaccine. But I do want to piggyback a little bit on what Penny was saying. The best vaccine available to anybody right now is the vaccine that you can get a hold of. It is, unfortunately, has been a little bit difficult to get the vaccine or to navigate the system since there hasn't been a centralized scheduling system, and every organization that has been able to get vaccine has their own way of scheduling patients. We have on our website on mysanitas.com a registry, and we're going to be reaching out to those over 20,000 patients that have already registered with us to bring them in and vaccinate them. Obviously, we have to also remember that there's a priority list based on the recommendations by the Department of Health, the Florida Department of Health, and soon as the inventory increases, it will be available to everybody, which is what we want. So, Penny said it well, roll up your sleeves. We are huge advocates of the vaccine. We do believe that this is the way to end this pandemic and get back to normal.
Absolutely. And do you see the enthusiasm? Are people calling in and inundating the phone?
Oh yes, absolutely. Like I said, we opened the registry a week ago, and we have over 20,000 registrations in the state, which is great. And this is regardless of insurance coverage or not. This is regardless of if you're a Sanitas patient or not. We will be getting everybody that we can vaccinated.
That's fantastic. I have two questions here from two viewers that I want to get to. Penny, I'm going to give you one. Islada, I'm going to give you the other one. Islada, this one's for you. They did not mention their name, which is fine. I have an undocumented friend and he needs health insurance. Any advice?
Absolutely. Our work as navigators is completely unbiased, and private. We can certainly, we can certainly help your friend get linked into certain community organizations or safety net programs that maybe are open to that demographic where you can get care.
Okay, fantastic.
I would have to find out the region, exactly where he's at, exactly. But it would be very helpful, if they would reach out to us as part of what we do as navigators. We're helping you get this wraparound service. So if we can't help you with your enrollment, we're going to find an organization and a community-based service or organization that will help you. So even if you're not eligible to get covered under the Affordable Care Act, we will find somewhere for you to go get coverage.
And speaking of reaching out, since this viewer is watching right now, where would they reach out to? And let's get that pen and paper right now.
So they can call they can call Epilepsy Florida at 877 hold on, I can never remember my number. 877-855. Actually, if you could put it up, because I'm giving them the call center number. There it is.
You asked.
I was going to give them the other number, 877-553-7453. And they can make an appointment with any one of our navigators. We have navigators that are, English speaking, of course, Spanish and Creole available. They can get an appointment 7 days a week, nights and weekends. And that navigator, of course, will link them up with any information that they need, any resources that they need.
That's great. Thank you so much. And Penny, another viewer asked about reaching out to those social workers that you mentioned to help with information to locations, COVID. Where can they go?
Sure. And I don't think you have that number up on your screen. So we're going to have to be careful, everybody, to write this one down. We laughingly say you can call, click, or visit. Right now, the call is the best way to go. So if you need help either navigating this system of how to select insurance, or you're trying to navigate the system on how to get to the COVID vaccine, call 877-352-5830. And they will be able to get you either to a licensed broker if you're trying to shop for insurance, or they can get you to our community specialists who can help you find access to care and access to the vaccine. Again, that's 877-352-5830.
Thank you so much, Penny. So much information we've had in the last hour. I want to mention one thing that someone wrote to me, and it's a friend of mine that does not want to be mentioned, so I'm going to respect that as well. But just vaccine scams, suggestions to people that hear that you have to pay for them. I think it's important to remind that they are free. Dr. Daza, can you talk a little bit about that?
Oh, yeah, absolutely. 100% covered. It doesn't matter if you have insurance or you do not have insurance. It is covered. Don't pay anybody. You don't need to pay anybody to get on any list either. Again, there is prioritization, and right now, and there's a reason for that. It's one thing that I really like to mention to everybody. There's a reason for the priority. First, the people who got hit worse and have a higher chances of dying from this disease, right? The elderly and those with chronic conditions, as well as frontline healthcare workers. Why? Because if we protect our healthcare workers, we can take care of more patients, and prevent more deaths. And then we start going down the list. So there's a reason for that. But yes, 100% covered. You don't have to pay anybody for anything.
And definitely go to a reputable source and get the right vaccine as well. That's very important. We only have about a few minutes left. Great hour. Penny, just final thoughts. We've covered the ACA enrollment, eligibility, all the different plans, all the way from bronze to platinum. Final thoughts from you?
It's an honor to be a part of this education opportunity. Thank you for putting the forum together and for asking us to be a part of it. The most important thing that I can bring to this table is Florida Blue is a mission-based company, is interested not just in our members, but in this community. We enjoy the fact that the highest number of people in the nation have signed up for the Affordable Care Act and are taking advantage of the assistance that the government is offering for affordable care. But we also have the distinction of people who are eligible but have not signed up. So the education can't stop here. We have to remain diligent, help our neighbors, help our friends to make sure that we're all covered.
Islada, final thoughts from you?
I have to agree with Penny. I think that education is so important. This forum and the ability to spread the word, especially to our local communities, about where they can go and access local assistance is extremely important. It's something that has lacked in the last few enrollment periods. And when you're not out there front and center, people just don't know where to go. So it's very important. If you know of someone, if you have health insurance, that's wonderful. But I know that each one of the viewers and everybody watching this knows someone who does not have health coverage, doesn't know where to access it, doesn't know where to go to ask questions. We work very closely with Florida Blue, and a lot of the clients go to the Sanitas clinics. We are all working in this together. And like I said, if we can't help you enroll directly, we're going to place you in contact with someone who can provide those types of services that you need. So the education is extremely important.
And Dr. Daza.
Yeah, I'll make it quick. Get coverage, see your doctor for your annual visit and your preventive medicine needs, and get vaccinated.
Great message. And with all those vaccinations, it feels like we're just getting closer, moving forward to a normal. I'm even going to use the word because I'm looking forward to it.
No, yes. And even the CDC just mentioned if you got vaccinated, people who are vaccinated can start getting together in smaller groups. So we're going to get there, step at a time.
Yes, we can have dinner with our abuelos and abuelas very soon. I want to thank all of you for your time. I know how busy you are, and we do appreciate it very much. Penny Schaefer, Market President, Florida Blue South Florida, Dr. Raul Daza, Medical Director, Sanitas Medical Centers, and Islada Soto, Director of the ACA Navigation Program for Epilepsy, Florida. Thank you all for all you do.
Thank you.
Thank you for the invitation.
We will
My
talk.
pleasure.
Hope to see you next time. Be safe. I'm Olga Villaverde, and we'll see you next time on Smart Life.